Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
All right, bitches, this is Kevin. Welcome to the Transformation Nurse Academy podcast. I hope that you enjoy the content. Today, we got something fucking great and shit, so hopefully you like it. This is called Gross Negligence and Unprofessional Conduct from LVN Lascano. I know people don't like it when I use names, but look at me. If you just go on the website, the board sent this shit to you. Like, you can sign up for email notifications, and they send you all kind of shit. I tell people, you are no longer Renee Ann Lazcano. You are convict VN 706038. You are owned by the state of California. You are guilty until you prove yourself innocent, which is very hard in the eyes of the Board of Nursing. So this LVN, she's from the Board of Vocational Nursing and Psychiatric Technicians. This case was brought around, the actual case started around 2021, 2022. However, it was just heard in October of 2023, and now she has been revoked until further notice. I don't know if she's going to get a second chance, but maybe she will. So here's what it says. Complaint seeks to discipline respondent's vocational nurse license for gross negligence and general unprofessional conduct. Complainant also seeks to recover the board costs for enforcement expenses. Get this shit. $22,318.75. So not only do you have to prove that you are fucking not guilty, you got to pay for that shit. So this lady has to pay $22,318.75 to prove that she wasn't guilty. However, this lady is guilty. Just my opinion. Anyway, we're going to get into this. This case came back from July 29, 2019. The Board of Vocational Nursing, license number VN 706038, to respond that the license was in effect at all times relevant to this matter and will expire March 31st, 2025, unless it is renewed. On January 24, 2022, complainant signed the accusation alleging grounds to discipline respondent's license. The respondent timely filed a notice of appeal requesting a hearing on the merits of the accusation. So what they're saying is, they said, you fucked up, you have to appeal, and she did sign the appeal hearing. So manager Lorene Cogniago, I can't say this, Lorene Cangiano, I don't know if I'm saying it right, so LoreneCangiano, as she had paid for her LVN school, so she felt she had to, I must have skipped some shit. No, that's right. Oh, so I backed up. I did. Hold on, sorry, I fucked up. Hold on. So she was accused on January 24, 2022. Let's see, this doesn't make sense though. All right, so here we go. It says, at all times relevant to the accusation, respondent was employed at the California Hematology Oncology Medical Group, or CHOMG, a small medical practice of 4 physicians specializing in cancer and blood disease treatment, and a staff of nurses and administrative personnel. Complainant alleged that on November 8th, 2019, while working at CHOMG, respondent administered IV medications and mixed and administered chemotherapy and immunotherapy to patients, and these actions exceeded the scope of practice of the licensed vocational nurse. So I don't know if you know, but I teach the IV therapy and blood withdrawal class, the certification class that is approved by the Board of Vocational Nurses in California. And there is a list, and I will write down the list so Jane can post this, but there is a list of medications that LVNs can give. So the topics are electrolytes, nutrients, vitamins, blood and blood products. Electrolytes, nutrients, blood and blood products. Underneath electrolytes, you have sodium, you have potassium, you have magnesium, you have calcium, bicarbonate, phosphorus. I know I'm probably missing something. And then under nutrients, you have dextrose, you have amino acids, you have carbohydrates, you have all of the minerals such as nickel, iron, palladium, gold, those kind of things like that. And then under vitamins A, B, C, D, E, and K, And in blood, you have whole blood, you have packed red blood cells, you have platelets, plasma, and cryoprecipitate. And in blood products are more like synthetics, like albumin, head of starch, hespan. You have epoetin and Neulasta. I don't know if I'm saying that. Neutralast, Neulasta, I can't remember. It's the one that helps increase your white blood count. If those medications don't fall under those 5 or 6 headings, LVNs cannot do it in the state of California. So chemotherapy is one of those things that even as a registered nurse, I can't give that shit unless I've had special training and certification. Ask my friend Nellie Shining Light, because she'll fucking tell you. So if you're not an oncology nurse, quit that shit. Anyway, the complainant's evidence. So the complainant, her name is registered nurse Lisa Marie Wells, formerly Lisa Marie Rich. So RN Wells worked at CHOMG from 1999 and 2019 when she was terminated from her position. 3 months later, in January 2020, RN Wells lodged a complaint with the board, giving rise to the instant matter. The complaint states, I was released from my employment as a senior RN from my outpatient oncology job within 3 months of our medical assistant obtaining her LVN license. So apparently this LVN Lascano was an MA. And so I do get a lot of MAs that come here to our company that want me to train them in how to do IV therapy. But in the state of California, medical assistants cannot start IVs, even if the fucking doctor says so. And this is where people fuck up. So anyway, the RN Wells, she said that this LVN did these things. So the respondent had no further education, including IV certification. So at the time she was given this shit, she wasn't even IV fucking certified. So the respondent has had no further education, including IV certification, which is necessary to work in an infusion setting. Limiting as it was for her, initially she was accessing portacasts. So if you don't know what a portacast, they call them implanted vascular access device today, or an IVAD. In the old days, we called them Mediports. Then we called them portacasts. Now they call them implanted vascular access devices, or IVADs. So they're implanted underneath the skin. The tip of the tube or the cannula, the lumen, goes all the way to the superior vena cava, to the lower 1/3 of the superior vena cava. Anyway, it says that she was accessing portacast and infusing non-chemo medications on Friday, my day off, and I had advised her several times not to do so as she was risking her life. She stated she could not say no to her employer, CHOMG office, to the manager, Lorene Cangiano, as she had paid for her LVN school, so she felt she had to. Just because somebody fucking pays for your school doesn't mean you're obligated to break the law or fuck up your license. That's stupid. Anyway, I continued to tell, this is RN Wells, she said, I continued to tell the respondent, meaning the LVN Lascano, our employer, Lorraine, and office manager, Jessica Hernandez, that she was working outside the scope of practice, but I was ignored completely. I was then asked by our scheduler if the respondent, meaning, LVN Lascano, could give chemotherapy, and I said no, she can't. The next day, on November 7, 2019, I was given a 1-month notice of termination from my employer. Lorene Cangiano stating there was no longer a need for 2 RNs in our practice, and they would keep 1 RN and the 1 LVN who was fucking doing what she wasn't supposed to be doing. So that right there, ladies and gentlemen, is called, what is it called again? What is it called? That's called harassment and retaliation. Cha-ching, cha-ching. So anyway, Lorraine, so she got the notice from her employer, Lorraine Cangiano, stating there was no need for an RN. They would only keep 1 RN, 1 LVN. On November the 8th, the respondent mixed and gave chemotherapy that I had advised her not to give. I continue to worry for the safety of the patients who are now receiving their infusions from an unqualified LVN. In January 2023, RN Wells, the nurse who'd been snitching, suffered a stroke, causing her to lose part of her memory. And she explained during the testimony, as she noted, this memory loss impacted RN Wells' recollection of some of the events relevant to the matter. So maybe she was under a lot of stress that she fucking had a stroke. During the RN Wells tenure there, CHOMG had 2 offices, one in Torrance and one in El Segundo. RN Wells divided her time between the 2 locations. So she seemed like a hardworking RN. And yet, what did they do to her? Fucked her over. So RN Wells was one of the 2 RNs working at each of those stations and the different 2 locations. All right? Among the duties, the RNs routinely performed reconstituting of drugs, which sometimes came in powder form and had to be mixed with saline or other liquids, probably like sterile water or dextrose, as well as administering these drugs to the patients by injection or by IV infusion through the Mediports. So each CHOMG location had a chemo room where medications were prepared and administered. Because remember, you're administering these chemos through a Mediport, which is technically a sterile central line going directly to the heart. So if you don't mix them sterilely and you can contaminate it, you can put those bacteria into the patients directly into the heart. According to RN Wells, each step of the process involved handling these often very toxic medications, which requires knowledge and skills even RNs would not have without specialized training. I am a fucking awesome nurse, but I do not know how to do chemotherapy. You need a specialized training and you need to be, I don't know, certified is the technical term, but you need to go through some type of certification or 8, 12, 16-hour class to learn how to handle these medications. So it says that nurses have to complete continuing education courses addressing oncology subject each year as she worked at CHMZ. So not only do you got to get specially trained, you got to keep up the fucking training because shit changed. RN Wells describes the challenges of reconstituting and administering cancer-fighting medications. You have to reconstitute the medications. Failing to do so could weaken or increase the potency, either of which could endanger the patient's lives. Some medications need to be dosed at higher or lower levels based on the patient's weight, calculated by using a complicated mathematical formula. And with the reconstitution phase, miscalculating dosages would result in life-threatening adverse effects. So as an LVN, do you get that training in school? Again, I teach the IV therapy and certification class. I do not cover chemotherapy drugs because chemotherapy medication and administration is a total separate type of certification and training. I do teach LVNs how to access ports and central lines because according to their scope of practice and the lawsuit of 2005, they can access these ports. They can, unless their policy states otherwise, as long as they are IV therapy and blood withdrawal certified. So the medications can also be very painful for the patients. They're infused into their bodies, especially those receiving repeat treatments into sites already bruised or where the body tissue has hardened. Maybe she's talking about PO, IV. So it says patients receiving their medications through a surgically implanted port, meaning the Mediport, port-to-cath, or implanted vascular access device, they are in danger of additional complications. So you got to make sure that blood return with their own blood products. So the patients receive their medication through a surgically implanted port are in danger of an additional complication. I don't understand what that means. Blood return. So you guys got to make sure where their own blood backs into the tubing during the medication, and RNs know how to position and reposition patients. That doesn't even make any sense. I don't even know what the fuck they're saying. I don't know what the fuck they're writing there, but that doesn't make sense. Change their breathing patterns to minimize its adverse effect. Patients receiving medication for cancer are susceptible to serious side effects. That's true, including kidney, liver, or heart failure. So I don't understand what it means about position, all that shit. I'm calling bullshit on that one. If you have to sit a patient up, down, sideways and shit, you shouldn't have to worry about that with a port if it's in the fucking right place. But I don't know. We'll have to ask the vascular guy to see if that motherfucker understands what that means. RN Wells stated the complications and challenges of administering cancer-fighting medications are such that even with her specialized knowledge and ongoing training, she and the other RN on duty, also duly trained, worked together. Over the phone, they checked each other's dosages, calculations. I don't know if I like that over the phone, but I guess it's okay. They checked other dosages, calculations. They consulted each other regarding patients' adverse effects as a further safety step. I mean, I get it, but I don't know. It's kind of weird to me. After respondent completed her LVN studies and obtained her license in 2019, RN Wells recalled seeing her take an increasingly prominent role in treating patients at CHOMG, including reconstituting medications and administering them both through IV and injections. So in 2019, she finished her LVN, but she did not become IV therapy and blood withdrawal certified. So she's reconstituting medications and administering them, both IV and injections. That's wrong because those medications do not fall underneath those categories that we talked about earlier. RN Wells was sufficiently concerned about what the respondent was doing that she spoke directly to the respondent, warning her not to undertake these responsibilities because they are not within her scope of practice. And being very recently licensed, often working alone, when the RNs were off, she would work alone and could make a serious mistake. So the RN, well, she spoke to the CHOMG staff physicians and office administrator, Lorene Cangiano, and none of them seemed to give a fuck. That's what it said. None of whom seemed to take her concerns seriously. So they didn't give a fuck because they had an LVN who did what she was told and they fucking saved them money. RN Wells does not recall whether she was at CHOMG on November the 8th, 2019, the only day complainant alleged respondent performed acts of giving rise to the dispute. So, because of the stroke and shit, she probably couldn't remember certain things. So then, during the hearing, RN Wells was asked whether the doctors working at the practice had ever administered medication. So this is what part of the problem was. They were saying that the LVN would access the port and then the doctors would come and administer. So they asked her basically in a hearing, hey, bitch, did you fucking see doctors administering the medication? RN Wells responded that the doctors never administered the drugs in the chemo room. So that's one thing that we should ask our chemo nurses, like Nellie Shining Light. Have you ever seen a fucking doctor administer chemo drugs after you did all the access? RN Wells responded that the doctors never administered the drugs in the chemo room. And in fact, except for briefly stopping by to ask a nurse a question, they avoided the chemo room altogether. That sounds about right. During the hearing, RN Wells was repeatedly asked whether she was a disgruntled former employee. I'd be disgruntled too, bitches, if you try to fire me because I'm telling on your ass. And she said, yeah, I'm a little angry and shit for being terminated, but she admitted to being deeply upset and hurt because she was dismissed for trying to do the right thing. Of course, I'd be upset too. She said she brought the complaint because she believed the respondent, the LVN, could not safely undertake reconstituting and administering cancer-fighting medication. So let's go back. Even if this bitch could safely undertake the reconstitution and administer the cancer fighting, let's say she was a smart motherfucking LVN, it's still against the fucking law in California. LVNs cannot administer and reconstitute medications other than electrolytes, nutrients, vitamins, and blood products. And that's only if it's not against your damn policy for your facility. So anyway, moving on, Associate Government Analyst Rachel Vieira was the first board investigator assigned to this complaint, and this was in February of 2020. So all of this happened in 1819, but they didn't start investigating until February 2020. So Vieira started investigating, and she realized that while employed, that the LVN was working outside of her scope of practice by administering certain medications. Now, here's why I don't like this. It says, at first when I started reading this, I was calling BS, but it says that she was accessing central line portacasts and mixing and administering chemotherapy. So when it said accessing central line portacasts, I was like, no, that's fucking bullshit. But you have to remember at the time that she was doing this, she was not IVBW certified. So that's why they said that she couldn't do that. Does that make sense? So because she didn't have an IVBW certification, all of this was out of her scope of practice. So in the letter dated February 24, 2020, Analyst Vieira stating in part her duties at CHOMG included administering all injections and immunotherapy under physician's supervision. So this is what the respondent said. This is where nurses have to understand the doctors do not have your back. Even if you're doing something outside your scope of practice or against the law, the doctors are not going to fucking stand up for you in the court of law. So this LVN said in the investigation underneath oath, she said, I am always supervised by the physician who always checks the patient's labs and gives the orders to administer the immunotherapy. It wasn't until recently, like in the beginning of 2020, I have recently completed an IV therapy and blood withdrawal certification course. On February 23, 2020, respondent received her certification. So she didn't receive her certification until February 2020. So from 2018 until 2020, she was doing shit against her scope of practice because she wasn't IVBW certified. And even if you are certified, you can't give immunotherapy medications. So CHOMG Administrator Lorene Cangiano herself and RN also responded in writing to Analyst Vieira's query. So in a letter that she wrote on February 19, 2020, she said, CHOMG is a private medical practice The LVN works under the supervision of physicians at all times. It doesn't matter if you're working under the supervision of a physician at all times. If it's not within your scope of practice, you can't do it. So even if you're working underneath the supervision of a physician, whether you're an RN or a LVN, you cannot work outside your damn scope of practice. So according to the RN, the charge nurse, she said that she was working under the supervision of a physician at all times. The physicians approve any treatment or procedure that the LVN does. The LVN works closely with chemotherapy certified registered nurses. Nothing the LVN does is independent of complete supervision of a doctor or nurse. I don't care if she hooks up the medications. I don't care if she reconstitutes the medication, she hooks it up, and you're watching her ass. It's still against her scope of practice, and she cannot do that, even if she's IV therapy and blood withdrawal certified. This is why registered nurses need to know their scope of practice and the LVN scope of practice. You can't make up stupid ass recordings, stupid ass rules and shit. You got to understand what you're doing. CHOMG Administrator Lorene Cangiano said that, that she was always under the supervision of a MD or a doctor. And we talked about this earlier. So Analyst Vieira also requested respondents' written job description, any record of discipline or counseling memos. And of course, there wasn't any because they're not paying attention to her. So in response to Vieira's request, the nursing flow sheet for the shift worked on November the 8th, 2019, CHOMG staff provided a document listing the patients treated. The document resembles a calendar with an appointment times along the left side of the sheet and treatments next to the appointments. On the page that, I got from the government's website, some of the entries have something called quote RL in small letters, or they have quote RL in capital letters, input after the treatment. RL are the respondent's initials, meaning the Renee Lascano. So basically, she's initialing that she gave the fucking treatment. Rosemary Chavez was the second board investigator to investigate the complaint against respondent. Chavez served a subpoena on CHOMG, directing production, and then they redacted copies of the documentation for the 13 page. So they're not allowing patient information, but they're getting the nurse's notes. Basically, they got the physician's orders, the nursing notes, the 24-hour charting. They got all the documentation. The subpoena directed the identifying patient information should be redacted and further instructed, do not redact or de-identify the names of the other healthcare providers. So they're telling them when they investigate, they're saying, give me all your fucking medical records, didact the patient's information, but don't take out who's treating the patient. In response to the subpoena, CHOMG's office manager produced an appointment detailed report listing 13 patient ID numbers and the medications the patients received, including one patient receiving GEMZAR. I don't know what that is, but that's probably some kind of chemotherapy. So let's look that up. GEMZAR. It's a chemotherapy medication. It can treat breast, ovarian, non-small cell, lung, and pancreatic cancers. And then the other one was Neupogen. Neupogen is the one I told you, though. Neupogen is a blood product. Neupogen is a bone marrow stimulant. It can help the body make white blood cells. To me, so that falls under the blood and blood products. Remember, I told you there's epoetin and Neupogen. The problem is this was done back in 2019 when she was not even IV therapy and blood withdrawal certified. So that's why she's getting in trouble. The other three were receiving something called Vidasa, and then two others were receiving something called Velcade or Velcidate or something. These are all cancer-fighting medications. So anyway, they were given that information. The complainant also presented the recording of Investor Chavez's interview. In the recording, at 4 minutes and 14 seconds, the respondent says she gives immunotherapy infusions. So on the recording, she even said she gives IV therapy immunity infusions. So that is a problem because at the time she was doing it, she was not IVBW certified. But even when she gets IVBW certified as an LVN in the state of California, you're not authorized to do that. So then 5 minutes and 50 seconds, she states she works with a physician on site. And then at 10 minutes and 32 seconds, she states that the doctor comes in every 20 to 30 minutes while she is administering the IV therapy immunosuppression medication. And then at 8 minutes and 34 seconds, she answers the affirmative to the question about whether LVNs may administer medications via IV infusion, noting that this is the case because CHOMG is a private practice, not a large institutional facility. It doesn't motherfucking matter. If you're an LVN who's IV therapy and blood withdrawal certified, you cannot fucking give immunotherapy drugs, whether it's a big facility or a small facility, you dumb fuck. So don't be doing that, you guys. No matter if the doctor's telling you, no matter if the RN's telling you, know your scope of practice. So board expert, they got a board expert like me. Her name is Rosinda Jewell, testified as an expert witness on behalf of the complainant. She has been an LVN in the state of California since 2005 when they got sued. She graduated and has been a mentor at the Unitech College in Sacramento. She's got all these credentials and shit. She's been part of the military. She testified. Now, this is where I get in trouble. So even though she's an expert, even experts can fuck up. So Miss Jewell's the expert and testified at the hearing. Her testimony was consistent with the report and summarized the following. In reviewing CHOMG's medical records from November 8, 2019, Ms. Jewell assumed, consistent with standard charting practices, the entries marked with the respondent's initials and indicated treatment administered by the respondent. As such, Ms. Jewell found evidence of the respondent violating the standard of practice. This is the case because the entries reflect administration of medications by IV, pursuant to the applicable, I can't even talk today, pursuant, let me get a taste of my fucking juice and shit. I got some fucking vodka here. Don't tell Miss Pat. And Miss Pat and fucking Robert are so fucking loud back there. As such, Miss Jewell found evidence of respondent violating the standard of practice. This is the case because the entries reflect administration of medications by IV pursuant to applicable law and regulations. LVN, this is where I have a fucking problem with this fucking board expert. Listen to what she says. LVNs, now, are you talking about just regular old fucking LVNs? Or are you talking about LVNs who are IVBW certified? Because it makes a motherfucking difference. Know your shit, RN. Are LVNs LVNs? Are LVNs IVBW certified? LVNs who are not certified can't do shit except IM sub-Q ID like that. They can't give shit IV. LVNs who are IVBW certified, as long as it's not against hospital policy, can administer electrolytes, nutrients, vitamins, blood, and blood products. All of those motherfucking things are medications. So stop saying they're not medications. You take a fucking syringe of normal saline and you push it in the IV, you are still administering a medication in the board's eyes. If you don't have a fucking order, you can lose your damn license. Look that shit up. Anyway, it says LVNs can only administer IVs after they have received certification to do so from the board-approved provider, which I fucking am. Something the respondent did not do until February. We talked about that until fucking February of 2020. And even then, this is where I have a problem. Even then, they can only administer IVs delivering electrolytes, nutrients, vitamins, blood, and blood products. However, this is where I got a fucking problem. She says not medications. That's where we as RNs are a bunch of motherfucking deets. Electrolytes, nutrients, vitamins, and blood products are motherfucking medications. Where do you chart that shit, bitches? On the MAR or the medication administration record. So stop saying that they are medications. It's just LVNs who are IVBW certified can only administer certain medications. That's a better way to state it. RNs may administer medications by IV methods, but if those medications are chemotherapy or immunotherapy or similar medications, they may be only administered by an RN who has specialized certification and training in oncology, which I don't. So I don't do that shit. Generally, LVNs may administer medications by injection, but not medications such as Gemzar, Propolis, and Velcade. What are all those fucking shit? You'd have to ask Nelly on that shit. Ms. Jewell further stated that LVNs are taught that they are subject to a defined scope of practice, and understanding these limitations is a part of the LVN's duty. So she's basically saying, LVNs, if you don't know your scope, learn that bitch. And don't do shit outside your scope, no matter what your fucking job or the doctor or a registered nurse says. So then they got to the fucking doctor. This is what kills me. Dr. Wade Nishimoto is an oncologist and served as CHOMG's medical director until June 30th, 2021. He experienced some memory difficulties while testifying at the hearing. Imagine that shit. That motherfucker probably knew everything underneath the sun until he had to go to trial and said, I don't fucking recall what the fuck happened and shit. I must be fucking getting old and senile. That bitch knows exactly what he did, but he didn't want to lose his license or his job or his fucking business. So magically, that motherfucker forgot shit. Pay attention, nurses, because they don't give a fuck about you. You have to protect your license. He experienced some memory losses. So he said Dr. Nishimoto stated he recalled clearly, however, that he was working at CHOMG on November 8, 2019. On that day, he personally administered all the infusions and injections for that patient. So yet all the RNs who were interviewed said doctors don't administer medications. But however, this motherfucker magically was the one administering the medication. So he lied under oath. According to Dr. Nishimoto's testimony at the hearing, he and CHOMG's other staff physicians routinely did this from time to time. Yet the other two RNs said that they don't. So who's fucking telling the truth? And we already know that fucking answer, bitches. Don't fucking listen to that. So at the hearing, Dr. Nishimoto was shown the medical records for that hearing that reflected the LVN's initials, RL, which stands for Renee Lazcano, next to the medication administered to some of the patients. Dr. Nishimoto asked why the respondent's personal initials appeared in the records, but not those of his. Excuse me, sir, why are her fucking initials on the records but not yours? Oh, well, that's right, bitch, because you didn't fucking administer them. So Dr. Nishimoto stated that none of the doctors charted treatments. That's a good question. So for those of you legal experts, if the doctor administers medications, are they required to put their initials? Because Dr. Nishimoto stated none of the doctors charted treatments they personally administered. And in fact, did not even have access to the electronic patient records. Oh, my Lord Jesus. This motherfucker's lying that you don't, is one, it's your business. Two, you're a physician there and you don't have access to the electronic records. I'm calling bullshit. Instead, the assisting nurses would insert their own initials next to the treatments administered by the physician. Look, bitches, I'm not that fucking smart. But I'm gonna fucking tell you, if a doctor administered the medication, I am not putting my fucking initials, because if I put my initials, it says I am the one who gave that shit. If you do that shit, you're a bunch of fucking dummies. So I'm calling bullshit, because I can't imagine that any motherfucking nurse would put their initials on what a doctor gave instead of you. So Jessica Ramirez, she's the CHOMG's office manager. After checking Chong's time records, she determined RN Wells, who did not work at Chong on November 8, 2019. During her testimony, Ms. Ramirez initially stated the respondents, meaning the LVN, initials next to the patient treatments indicated respondent had administered the medication. So even the office manager threw her ass under the bus. Oh, yeah, RL means that she gave the drugs, not the doctor. But yet the doctor's saying, oh, no, I gave it, but she just signed that I gave it. See what's happening here? That's why you had to be smart and not stupid. So anyway, Ramirez stated that the initials next to the patient's treatment indicated respondent had administered their medications, but then changed her testimony, stating the notes reflecting patients treated at Chong were the appointment notes, not the nurse's notes. Yeah, because she didn't want to fucking get in trouble. Now, the respondent, at the hearing, the respondent testified on her own behalf. She has worked at Chong, CHOMG, since 2022, or no, I'm sorry, 2002. Initially in a largely clerical capacity. So she went from a cleric, like a secretary, to a medical assistant to an LVN. So she felt a lot of obligation and felt like they had helped advance her career, and nobody had ever snitched on her, but now this RN snitched on her. Now they're all in fucking trouble. So because it was a small private practice, she worked at CHOMG under physicians, close supervision, that this work included administering injections and IVs. So this is a very common thing in California, maybe elsewhere, but I get a lot of medical assistants who tell me they start IVs, they give IV medications because the doctor says it's okay. It is not okay. I don't give a fuck what the physician says. You cannot administer medications in certain ways if it's against your scope of practice. Stop doing that shit. Stop listening to the fucking dumbass doctors if they don't know. So she stated Dr. Nishimoto directly treated the patient seen on November 8, 2019, and she stood by to assist and even took notes from her own edification, but did not retain them. So she's full of shit. So now she lied. The respondent presented 3 letters of recommendation. I wouldn't even fucking write a letter of recommendation for this kook. So she got recommendations stating that she was good and stuff. So respondent also prevented all her certifications and stuff, but I wouldn't fucking have done it. All right, so the analysis of the evidence. So here's what they found. R.M. Wells' testimony was pervasive and credible in establishing the significant dangers and challenges of reconstituting and administering medication to cancer patients. Her testimony on that score was well reasoned and detailed. Even though she had a fucking stroke, she was well reasoned and detailed. But the other fuckers, non-stroke victims, or the non-stroke cocksuckers, they couldn't remember shit. They couldn't get their story straight. So R.M. Wells' testimony also credibly established respondents' encroaching role in work formerly undertaken by RNs. To the extent R.M. Wells' memory was compromised, she candidly admitted to any deficiencies and gaps. R.M. Wells' statement submitted to the board in connection with her complaint supplemented her testimony. R.M. Wells is not a participant witness to the events occurring on November the 8th, 2019. She testified she could not recall whether or not she worked, so she was honest. A reasonable inference to be drawn from R.M. Wells' testimony is that the respondent took over R.M. Wells' duties after R.M. Wells. She didn't leave. This is why I don't like this. It says after R.M. Wells left, she didn't leave. She was kicked the fuck out. So it pretty much says that she, the investigation revealed that this LVN was doing shit she wasn't supposed to. So because of that, these are the lists. So the cost of all this testimony, all these legal experts, came out to be $22,318. So the board has the authority to discipline a LVN for unprofessional conduct and for violating any provisions in the board's code. So the standard of proof in an administrative disciplinary action against the license is clear and convincing, according to an older case called Edinger versus Board of Medical Quality Assurance. The California legislature has declared the practice of licensed vocational nursing to be a profession. The clear and convincing evidence standard requires a finding of high probability or evidence so clear as to leave no substantial doubt. Well, look at me. We have no doubt this bitch did it. I don't care what she says. A licensed vocational nurse, when directed by a licensed physician and surgeon, may do all of the following: administer medications by hypodermic injection, withdraw blood from a patient if the licensed vocational nurse has been instructed by a physician and surgeon, but has demonstrated that she has achieved certification through a board-approved course. They can start and superimpose intravenous fluids as long as those fluids are what? Blood products, vitamins, nutrients, and such. Does that make sense? So that's where you got to understand. You're limited to what you can give. The LVNs have to have, they have to go through the course like we teach. So as a first cause of discipline, the complainant allegedly responded committing gross negligence on November 8, 2019, because she administered chemotherapy and immunotherapy to patients even before she fucking was certified. Which even if you're certified, remember, you can't do that shit, bitches. And then they said she was unprofessional. She was incompetent because she didn't receive proper training and worked with outside her scope of practice. In this case, the respondent reconstituted and administered toxic and dangerous medications, both by injection and intravenously on November 8, 2019, when she was not yet certified to even perform IVs. Even if she was certified, would not have qualified her to do so, except to use the IVs to infuse supplements and blood products. So when they say supplements, they mean electrolytes, nutrients, vitamins, and blood products. So because she did so without fucking the certification, she really got slammed. So what happened to her? In reaching the decision, the appropriate level of discipline, the board must consider the guidelines entitled Disciplinary Guidelines and Uniform Studies Standards Related to Substance Abuse. I don't know where fucking substance abuse comes in, but okay. So what did they do? What did they do to this bitch? So they basically suspended her license and they revoked her license until she fucking does what? So it says, respondent at her own expense shall enroll and successfully complete a course substantially related to the violation no later than at the end of the first year of probation. The coursework shall be in addition to that she renews her license. It says she's going to be under supervision. Respondent shall not function as a charge nurse, work in any healthcare facility as the person who oversees direct license. She has to be under supervision. The board has to approve the plan. She has, the respondent shall at all times maintain an active license with the board. Should the respondent's license expire, then she's fucked. The respondent shall pay the board associated costs, which is the $22,000. During the probation, if the respondent ceases practicing due to retirement, health reasons, or any other unsatisfactory conditions of the probation, she got to surrender her fucking license. And this all came down by Deena, Deena R. Gailey, who is their administrative law judge. So there you go, ladies and gentlemen. This is the case of Renee Lazcano for gross negligence and unprofessional conduct. So if you don't think that you are held responsible just because the doctor fucking tells you to, here's a fucking case for you bitches to go over and study. So I encourage you, I'll give the link to Jane so Jane can put it in the post and stuff and you can download it and read it. You can talk about it, reflect on it. All right, man, I appreciate you. I hope that you enjoyed this shit because I did. And I appreciate you. Make sure you follow transformationnurseacademy.com. Follow us on Instagram, Facebook, and TikTok. All right, bitches. Peace out. I love you, motherfuckers. Have a great night. Yeah.
Don't miss out. Engage with us weekly. Share your thoughts. And let's transform the nursing landscape together.